You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We are on location today. Brought the Wellness Hour cameras here to the Center for Age Management. With us, we have Dr. Cole today. She's allowed us to bring our cameras here. We're going to go behind the scenes. We're going to meet her on consults with patients. It's all about bioidentical hormone replacement therapy. We're waiting for Dr. Cole. She should be coming through that door in just a moment. Dr. Cole.
Oh, hi, Randy.
Thank you for having us here.
Well, it's a pleasure. Thank you for coming.
We finally made
your
it.
crew. This is welcome to my office. This is Noelle.
Hi,
She's our
Noelle.
receptionist.
Beautiful place.
Thank you. Thank you.
So you helped design?
Well, no, but we came up with the idea and that healing should begin as you enter into our office.
Okay.
And we had a lot of help from another physician's wife who created the feng shui in the office.
Okay.
Now this is Dawn. Dawn
Hi,
is my
Dawn.
lead nurse. She's terrific and helps me out quite a bit. Deals a lot with my patients.
So people come right over here. This is this a checkout area?
Actually, we check out up there, but Dawn is here kind of managing front and back office, coordinating the two. She really works very closely with me. These are a number of other exam rooms.
Okay.
This is Diane.
Hi, Diane.
Diane's my lead nurse in the back office.
Okay. She meets with the patients as well.
She does,
Okay.
absolutely. She goes in after I see a patient, and sometimes there's additional questions, and she'll go in there and finish up with the patient in the room.
Now there's a story here.
This is terrific. This is a patient of mine for many, many years. This is a woman who's about 82 years old, I think, when she did this for us.
She painted this when she was 82.
She did. And she does some
Okay.
beautiful work in San Diego, and she's still my patient today.
Is that right?
She sure is. And
So she was so happy
yeah,
with the experience.
She did. She still belongs to this other medical group, but I'm her other physician.
Okay,
and she
great.
just has followed me over here.
For those just tuning in, you're watching the Wellness Hour. We're on location today. We're actually in the waiting room of Dr. Cole's office, specializing in bioidentical hormone replacement therapy. Dr. Cole, thanks for allowing our cameras here today.
No, it's my pleasure to have you.
Beautiful office.
Thank you.
Beautiful decor.
Thank you.
Who's your typical patient?
I think I have a few groups of typical patients. I could have the walking well. They come in here, they feel fine.
Walking well?
The walking well. They're 50 years old. They feel well, but they're concerned. How am I going to age? What can I do to control what's coming down the pipeline for me?
Okay.
How can I take an active role? Then I'll have a very symptomatic group, again, 50, 60-year-old, and they are feeling the symptoms of multiple hormone
Mostly women?
deficiency. Oh no, women and men.
Oh, really? Okay.
Women and men. And then I have a group that's very interesting who are very ill. And
A sicker group of
a
patients.
sick group of patients who have been to their physicians and have gone through the regular medical treatment and are doing very poorly. And this is a group that has really fallen through the cracks of our system, and they find me.
Okay. Now, before we get into today's topic, for those that don't know you, we've had you on the program before. Let's talk about your background, your training, how you got involved in this functional medicine, as you call it, style of medicine, and explaining that as well.
Okay.
So tell us about your background.
Okay, so I went to an osteopathic medical school. The Navy put me through school. I did my residency in family practice, and shortly thereafter joined a very large medical group in San Diego.
She started doing family practice.
That's right.
Okay.
I was board certified in family practice. I had a fairly large practice in San Diego. I had a lot of elderly patients, and I got to a point with the practice where they would come in and they were ill and they were on multiple medicines, and I found I was symptom treating. They would give me a symptom, they
Were
felt
you writing
ill.
a lot of drug prescriptions?
Yes, because you would have such a short time to see a patient, and you want to make them better, and you ended up writing another pharmaceutical. Shortly thereafter, I went to my first anti-aging meeting. It was in 1994, and I really fell in love with the field because it was prevention. It was what can I do to move someone to better health. I started working with the hormones, and that led me to functional medicine because just balancing hormone levels didn't really give me the full picture of the patient and didn't
Okay.
explain the symptoms, and I married it with functional medicine.
Now, a lot of people know you, and I've met a lot of patients today of yours, and I was very impressed with some of the things they were saying. But going into this, I thought, okay, Dr. Cole just does hormone replacement therapy. They said you did things like, change their medications. You told them what supplements to take, fish oils, things like that, nutrition. Didn't know you were really telling them what to eat. But you're doing the whole picture here.
We do.
Is that right?
We do. We have an extensive
Is this
program.
holistic? Is it alternative? What is it?
This is a marriage of all of those
Okay.
because I will use prescriptions when necessary, but a patient will enter in, maybe they have high blood pressure, maybe they have high cholesterol, maybe they've gotten fat, they're a little bit more obese than they
Right.
used to be. Now they have insulin resistance, maybe early onset diabetes we're catching. But we can do a lot of things from what food they're eating, to their thoughts, to their stress, to their hormones. There's a lot of things that we can do to move that patient to a better place. So we do the whole bit here.
A lot of negative press, because we're talking a lot about the positives today,
Right.
but a lot of negative things anticipating this interview, looking into this, about hormone replacement.
That's right.
Causes cancer,
That's right.
causes men to, in some cases, lose their hair.
That's right. So in 2002 was the big study, the Women's Health Initiative. Personally, I think
Sure.
it was a disaster for women. It was really a poorly designed study. It looked at a group of women who were over 65. 2/3 of them were over 65. Clearly not the menopausal woman that I'm seeing in my practice who's just 50 years old or even younger.
So are you saying that the study was not accurate?
I'm saying the study had a lot of flaws. The initial flaw, the biggest flaw, is they looked at Premarin and Provera.
So are you saying that, I guess that's a combination of progesterone?
They use Prem-Pro, which is a combination of Premarin and Provera, Provera being a progestin.
Okay.
Very
so it's not
different.
the kind of hormone that you're doing. Are those synthetic hormones?
Those are synthetic. They're very, very different than your bioidentical hormones.
Does this come up a lot in your practice? Like the dangers? They
Yes,
have
it
questions,
does.
they have fears?
Absolutely. And on that first visit, I will go through the whole Women's Health Initiative with that patient and show them how it's different. What are the differences between progesterone and progestin,
Okay.
Premarin and bioidentical estradiol? They're very different.
What are the common misconceptions about hormone replacement therapy?
The biggest one is that it causes heart attack in normal healthy women.
Okay.
In fact, there's studies now that show if you intervene very early in a woman's care, you actually decrease the amount of heart attacks that this woman has. Not using Provera, but using bioidentical hormones.
Big difference.
Big difference.
You're not selling them here.
No, no.
You write prescriptions?
I write prescriptions, and we have a compounding pharmacy that we work with that will fill our prescriptions, and that's how we do it. Kathy came to us about a week ago, and she's very typical of the kind of patient I see in my practice. She's 49 years old. She came to us complaining of a number of symptoms very common in menopause. She said she was exhausted, she was irritable, she was cranky, she had no sex drive. She's been trying very hard to lose weight, and although she looks pretty terrific, she has about 10 pounds that she would like to still lose and is having quite difficulty losing those. So she presented very much like many of my patients. I met with her, we did a full exam, and based on her symptoms, I've asked Kathy to get some lab work, which she did do. I also explained to her that sometimes it's not just the hormones that are out of balance, but there could be a lot of other metabolic changes that we need to concern ourselves with. So this is really a very typical follow-up for me. We're in one of my exam rooms, and this is really where I meet the patient, and we will go over, she will look right with me and look at her lab work, just as I look at her lab work, and we'll go through it and see what we can come up with for her based on what I'm seeing for her today. So in Kathy's case, and I really do show my patients all the lab, we start and we look, and we go through some general lab work. Kathy had something called a blood count and some chemistries, and in fact yours are all very good. Now Kathy came to me from another physician who had treated her with hormones, and sometimes this is what we see, and in Kathy's case the hormones were very much out of balance. Kathy came to me with a testosterone level that is higher than the men I treat. So you are way out of balance with the amount of testosterone you've been prescribed. Your estrogen, though not bad, is still somewhat low, and we certainly want to adjust that. We looked at DHEA because it tells me a lot about the amount of stress that you've been through. DHEA is an adrenal hormone. It has a lot to do with memory and your mood. It's almost a perfect little menopausal hormone. There have been some beautiful studies done on DHEA and its effect on the breast, and it doesn't seem to convert to anything, on its effect on the uterus, and it doesn't convert, so it doesn't cause growth or problems. But in the bone, it seems to convert to androgen, so it builds bone. And in the vagina, it seems to convert to estrogen, so will lubricate. So your DHEA is somewhat low. It tells me you've been stressed. Many things can decrease DHEA. Eating too much sugar. Not sleeping is a very common thing that we see that will knock down DHEA. Too much worry, too much fear, too much anger, which maybe you have because your testosterone level is so high.
Oh, I've been so crazy.
So your DHEA is quite low. C-reactive protein we measured in you because many of the diseases of aging are inflammatory. And inflammation starts from our diet. It can be just really from the things that you're taking in. It could be that you have a sore knee, a sore joint, there's something else going on here. But C-reactive protein is very important for cardiovascular disease as well. As a matter of fact, all oral estrogens will increase C-reactive protein. So the studies that came out with the Women's Health Initiative and said, oh, there's more heart attacks with estrogen, these were all women who were given estrogen orally. But your C-reactive protein is quite high, so we will look at your diet and go through what you can do, starting with diet, and what we can do with nutrients, as well as managing some of these hormones that may lower your C-reactive protein. But it is quite high.
With my testosterone being as high as it is, then how come I have no sex drive at all? None. And I still have all these hot flashes and the night sweats. I thought that was supposed to take care of those symptoms.
You ask a very good question. So your testosterone being so high actually can contribute to your night sweats and to hot flashes. The other thing is that your estrogen is still quite low. So for you to have a healthy libido, you need an adequate estrogen level and a much reduced testosterone level. Okay. I think that high testosterone is affecting the hot flashes as well as the low estrogen. So Kathy, I've explained a lot of things to you today. This would be the point where I need to spend a few minutes more with Kathy to come up with her program and to kind of pull her program together for her. So we have another 20 minutes together, and then we can come back to you.
Now, you were looking for a hormone doctor.
Yes, I was.
When you met Dr. Cole.
Yes. Actually, I didn't know what I was looking for because I didn't think there was one out there that would help me the help that I needed.
Now, you thought you were getting hormone replacement therapy before.
Yes, and I knew that was the wrong thing because it made me ill. And I didn't understand it because I was having hot flashes literally all the time. I couldn't even dress properly. And at nighttime, I never slept because I was so hot.
Right?
And I felt really desperate.
What were you doing at that time?
Nothing.
Nothing
Because
at
I
all?
had quit the Premarin
Okay.
regimen, which was making me ill. But on that Saturday morning, I
Was that simple? You read an article.
I read an article, and it convinced me this is who I want to go with. And I called the number, and expecting to get a receptionist or a nurse on the phone because this was Saturday,
Sure.
and Dr. Cole answered,
Is that right?
which I thought this is really quite delightful that a doctor herself is answering. And we talked quite a bit about my symptoms and what I was going through, and she immediately said, I think I can help you.
So what was it like on day one?
Entirely.
I mean, how is it different than what you've experienced? as far as-
Entirely different. I mean, completely different from anything I've ever experienced. First of all, the appointment was a whole hour,
Okay.
and we talked.
But
And
you say it was different. How so? I mean,
because
right off the bat.
it was personal.
Okay.
It was very personal. Whereas with other doctors, it isn't a personal situation at all. And I immediately felt comfortable with her. And she said, "This is the blood test we need to do, and we need to see where your levels are." And I thought, voila.
What do you want people to know, other women out there?
That there are alternatives to the hormones that the regular gynecologists give.
Do you tell your friends about
Yes, I do, and
Is that
I'm
right?
so adamant about it. Yes, and I tell them about Dr. Cole.
this? So it's bioidentical hormone replacement.
Yes,
You get creams, and what are you doing?
they're creams that I put on.
Made by, she gives them to you here?
No, they are made at a university compounding
pharmacist.
Yes,
Okay.
that's it. Yes, and that's what I appreciated about it too, because they are made to exactly what my system needs,
Okay.
not what every woman out there needs,
Sure.
but what I need.
So this is just your regular medical stuff. I guess you spin blood there, things
That's
like
right.
that.
We collect all our own blood. We spin our own blood. We send it out. We do EKGs. We do
EKGs here as well?
absolutely. So we
Okay.
do really. My practice is conventional, and it's integrative. So we
Okay.
do all the disease detection as well.
Okay, good. Now, what are we seeing over here?
In this room, we do a lot of our facial skin care. This room is a larger room I see most of my new patients in. And then we have a third room that we use as another consult room. Come on over to my office, Randy.
Okay. Do
I-
you meet with people in your office? You take patients in, or more of a working
Occasionally,
office?
but it's more of a working office. I'll take some phone consults, that kind of thing.
All right, all right. Now, okay, so mostly this is a working office.
Yeah.
You do paperwork,
Paperwork.
meet with patients on the telephone. Now, I guess from talking to one of your Beverly Hills patients, a lot of what you do is over the telephone as well.
I will do work over the phone. I have to meet with patients in person at least once a year, but
Okay.
follow-ups we can do
So
over
for
the
those
phone.
people that already know you, they have friends, you do over the phone consults.
I absolutely do. We can get things started. I can have a first visit with them, order their lab, and then their follow-up could be in person, so I could do a full physical and go over their lab results.
Great. Now, for people just tuning in, we're on location today with Dr. Cole. Today's topic is bioidentical hormone replacement therapy. She's kind enough to allow our cameras on site here. We're going to go in on some consults with you.
Absolutely.
We're going to interview your patients, and we'll go from there. We'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We are on site today. We actually are in Dr. Cole's office in her waiting room. We made a mini studio out of this. We're going behind the scenes today. Now, Dr. Cole, what are the commonly replaced hormones?
We look at estrogen, progesterone, testosterone, DHEA, pregnenolone, growth hormone, melatonin, thyroid hormone, all of those hormones.
Let's start with thyroid. How does somebody know if they have a thyroid condition?
Patients with low thyroid can present with fatigue. It's a fatigue that is morning fatigue. They're very slow to start. Once they get going, they may do better. They have
So it's the energy?
it's energy,
Okay.
it's metabolism. You know, thyroid's very important for burning fat, so they may gain weight, they may have dry skin, they have depression, they can't focus, they're
So
exhausted.
thyroid is connected to every one of these things.
You know, the hormones, as I always explain to my patients, you can't just fix one because it's like a symphony of hormones. It's a web of hormones. One interacts with the other. And so you can't just replace estrogen or thyroid. You can't.
Is there some of that going on out there?
There's a lot of that going on out there.
Is that right?
Yeah.
You think if there's a mistake that other doctors are making in the world of hormone replacement? Because I spoke to a lot of the patients today of yours, and they said, I went to 5 other doctors. One said they went to other doctors, and your approach was different.
It is
So
different.
what's a mistake you think that's going on in the world of hormone replacement?
Well, one, they don't use bioidentical hormones. That's a
Okay.
big mistake. But two, they don't look at all of the hormones. For example, it's very common for a woman who's had a hysterectomy to be advised that she doesn't need any progesterone, or
Okay.
progestin is usually used. I think that's wrong. I think we have progesterone receptors in our brain and the breast.
Any studies to back up any of what
There's
you're saying?
tons of studies to back this up. And so progesterone has a role even if you don't have a uterus, but it's not in conventional care. It's not being used.
Okay, how do you determine somebody watching this, they're saying, okay, maybe I have a hormone problem. How do you find out? Obviously just testing.
Men and women generally know. Things aren't the same. You know,
Okay.
men will go to the gym, they don't get the response they used to. They come home, they're tired. What brings men in often is their work performance goes down. That often will bring in men. Women, they gain weight, they can't think. With women going into menopause, they can't think. Memory is we think it's hot flashes, but memory loss is one of the most common complaints that I
At
see.
what age does this start happening?
Well, hormones can start changing at around 35, really.
I mean, some of your patients are that young.
Oh, absolutely. And at the 35-year-old, we call it kind of perimenopause, but they'll
Okay.
start being deficient in
So
progesterone.
perimenopause.
Right.
Give us some of those symptoms.
They'll start to have increasing symptoms of PMS because progesterone is a natural tranquilizer. It actually stimulates something in the brain called gabapentin. And so all of a sudden they're more anxious. They don't have progesterone. Their periods are a little bit longer. or they'll have irregular periods. So those are some of the first things that change. Maybe estrogen dips down a little bit. Oftentimes we may see testosterone deficiencies early on, and that can be because the woman's on birth control.
I've talked to people, some women, they say, I tried hormone replacement, it didn't work.
It's not simple. You can't just start a patient on a program and maybe get a level or not get a level. We're constantly redoing it. We have to look at their metabolism of these hormones. We have to look at what the balance is, what they need. And so it can take a little while.
Now, your patients say tweak, that you tweak the hormones.
We
What do you
do.
mean by that?
I work with levels and I work with symptoms.
Okay.
So we'll start a patient on a program within a week. I'm saying call us, tell us how you're doing.
That means you may add?
I may add,
away.
or I teach them how to up their dose if they need to, or decrease the dose if they need to, and then eventually we'll do our levels to back up what we're seeing clinically. But it does, everybody's so different. The absorption through the skin could be different.
Hi, how are you?
I'm fine. I'm Dr. Cole. Nice to have
Hi.
you here. So, Bob, how did you hear about my practice?
Through my wife. She's a patient of yours.
Oh, that's great. So, tell me, what brings you in here today?
I'm tired. I'm putting on weight that I'm finding harder and harder to take off. It used to be a little easier. Hit 40, so, you know, it's
You're-
not so easy anymore.
So, you're 40 years old.
Right.
Okay.
So,
And do you have any medical problems that you've had in the past diagnosed?
based on what my wife said, she thought I might have a thyroid problem, but I've been checked by doctors and they say it's okay.
It's possible that your doctors did some blood tests and didn't look at it so completely and may have come up with a wrong conclusion.
Really?
So we may redo some tests for you. I think I look at thyroid a little bit differently. So
Okay. In what way?
most doctors, I find, order just one test. It's called a TSH. And oftentimes that doesn't tell the whole story. And so we want to do a full panel. The other thing that can be often missed is if you have autoimmune thyroid conditions, and that requires a special blood test as well. What I'd like to do at this point is order some additional tests on you that'll give me an idea of what's going on with your hormone system. I would
Okay.
like to do our vitamin analysis so I can best customize what you need. Give me a lot of information about your metabolism as well.
Okay.
You know, you present very much like a lot of my patients who are about your age who possibly have low thyroid, perhaps low testosterone. Men your age will convert their testosterone to estrogen. We see that weight is up, and you'll have a tendency to do that. We can reverse it. You're going to feel much better once we get the additional information on you. I do want you to start on the diet that we talked about, the low glycemic diet. We'll see you back in about a week. We'll have all of your information, and I'll put together a program. I know Bob's going to do great. Men in my program like Bob who have difficulty losing their weight, a little bit depressed, a little bit tired, try to work out and do the right thing and get no response. They end up usually being low in testosterone, perhaps some thyroid. They do excellent on our program, and I can't wait to see his results.
Now, you were feeling lousy at one time.
Lousy is an understatement. I was tired. I was cranky. I was depressed. You'd be tired too if you didn't sleep at all.
Okay.
Because you had so many hot flashes that you'd wake up and the bed would be soaking.
So how long, so you were well into the menopause?
I was.
At the time.
I was. And it created havoc on all my relationships. And my hair, which got my vanity. Because my hair began to fall out
Is
on
that
top
right?
of it. Yeah, so.
So what were you doing at that time, before you met Dr. Cole?
Well, I was doing what most women do, too much, you know. So I kept running to doctors and saying, fix me. I don't have time to not have energy, to be crabby, to be crying, and have my skin atrophy. And they'd give me, you know, a pill and say, okay, go home and take this, and it'd make me worse.
Right.
Or go put this patch on, and somehow, we don't know why, but it doesn't work on you. And I must have been to 5 doctors. I think at least 5
How did you hear about Dr. Cole?
A girlfriend of mine who had similar problems.
Now, you're all the way in Beverly Hills, so how did you
Right.
hear about Dr. Cole out here?
Well, you know, you work the network. That's what we women
Okay,
do. So
okay.
a girlfriend said, you know, you got to go see Dr. Cole. She'll get it. She'll get it. And I said,
that right?
you know, I don't think anybody's going to get me, but she said go. So I
Okay.
went, and Dr. Cole and I immediately clicked.
So not only is she doing bioidentical hormones, She's
Right.
telling you what supplements to take.
Right. She's telling me what supplements
Nutrition
to take.
as well?
Nutrition. She'll say we need to clean up your diet.
Sounds
because
complicated, though.
It's not. It's really not.
She puts it all
complicated.
together.
It's much